Hello everyone, this is Bob Sullivan again. We're talking about a brief overview of drip sets and how to choose the correct drip set to set up your IV for based on what your patient needs. And then there's some other videos about actually setting it up and calculating it later. This is just an overview of the different types. So to start, when we talk about an IV drip set, we're going to talk about the tubing that connects the bag of a fluid, usually as normal saline or lactated ringers, to a patient, and there's going to be this drip chamber. So as you open it up, there's a clamp that I'm going to open, and you're going to see fluids flowing, and if I slow it down, you'll actually see drops. And the size of the drip set bases how many drops, how many of those drops, or the Latin abbreviation GTTS, is in 1 milliliter. So, I'm just going to show this again. Each of these drops how many of those drops that are flowing are needed to make 1 milliliter. Now, we have two general types, and I'm talking about the primary. IV. You're going to start on a patient, and then we'll go into the drip sets that are used for medication, primarily for medication infusion. And then there's some specialty types that I'll touch on at the end here. So we have macro and micro drip tubing. And macro drip tubing is what we're going to usually do when we start our initial IV for fluid resuscitation, or for just in case if we're going to give medications through it. Macro drips come in three sizes, and it's 10, 10 drops per milliliter, 15 drops per milliliter, and 20 drops. And this all depends on the manufacturer. It might depend on a pump. Frankly, I don't know. I wish there was one. I'm not sure why there is. If you do know, please leave a comment or email me. But so the macro drip sets come in three sizes. And so this is a 10 drop set, and that's the drip chamber. And we just go with what we get different donations from different services and hospitals. This is 15 drops. This is actually as a cassette that can go on a pump. That's the drip chamber. And we have a 20 drop set. This one's kind of old, but you can see, so 20 drops per milliliter. Now if you look at all of these, the drip chambers on all of these, can't really tell just from the drip chamber. Once you take the macro drip set out of the package, there's no way to know what type of drip set it is. It's kind of like taking a medication out of a vial. These aren't color-coded. There's nothing standard, at least that I know about that. Once this comes outside of the package, if it's the macro drip set, you're not going to know how many drops per milliliter that is. So when you're infusing fluid. Now the micro drip set, on the other hand, will always be 60 drops per minute. So this will always be 60 drops per minute. And when I take this one out, you'll notice that there's a needle in the drip chamber. The micro drip set is always 60. So if you have a micro drip set it will take 60 drops to make 1 milliliter. This one always has the needle. So if you opened your bag and you didn't pay attention or forgot which size drip set you had, and you lay this down, you really can't tell. Fortunately, if it's a macro drip set, it is usually not clinically significant if it's a 15 or a 10 drop set, or a 15 drop set and a 20 drop set. Unless you get to the 10 drop set versus the 20 drop set, then that could be significant. If you're infusing a medication with a 10 drop per milliliter drip set, it will run twice as fast as the 20 drop set. So that is significant, but not as significant as the micro drip set. So if you have the micro drip set, you set this down, maybe you open 2, the one with the needle is the micro drip set. And the micro drip set is almost always used for infusing medications with, where we need to be very precise and accurate over a fixed amount of time. More and more agencies are going to pumps, which is great, but yours may not, or the pump might break, so you may still need to count the drops and do the medication infusion. Okay, so just look at the difference between the flow rates. On the left is a macro drip set. Honestly, I don't know what it is. I think it's 10. I think it's the packaging that was in 10, but we've been using it for training, and it came out of the package, so I can't be sure. But I do know it's a macro drip set because there's no needle. And so we're just going to open this up. So we have a patient who's, we'll say they're dehydrated and they need a lot of fluid. We're going to try to give them a liter of fluid. So if I open this up, you can see that's kind of like a waterfall or a sink running. And then maybe I get my liter in and they look a little better, so I don't want to give them as much anymore, so I'm going to cut it back maybe to KVO, or we'll do a drop over 10 seconds. Or maybe I'm going to give a medication and a patient has hypertensive. I don't want to give them a lot of fluid, but I want to be able to control the medication, and so I'm going to give it to them. I set the drip rate KVO, so say a drop every 10 seconds or so. And I give my medication, and now I'm going to open it up just because I want that medication to run in. And now I'm going to cut the back. I'm going to turn the chamber back to the keep vein open rate, which is about a drop. Whichever drip set you use, it's going to be a drop between 10 and 15 seconds. Okay, so I'm going to go over to my macro drip set. Same type of clamp. And I am going to set up my medication infusion there, as I want to give 1 milliliter every minute. And I have to be so careful because it's a vasopressor that can be very caustic and can be harmful if I give it too fast or the wrong rate or not fast enough. So I want to set this open, and look at how much smaller the drips are. There we go. Look how much smaller the drops are compared to the macro drip set. So I need to cut this back. I want to do 1 drop per second. 1,000, 2, 1,000. I'm usually can't do this that quickly, but I got lucky. So we want to do 1 drop per second. And if I do 1 drop per second, that's going to be 60 drops in a minute. And if I have a 60 drop per milliliter set, that's going to be 1 milliliter a minute. Okay, well, let's say this dose isn't working. I'm not getting the blood pressure response that I'm looking for. So we're going to make it 2 drops per second on 1,000. Go the other way. Too much. 1,000, 2, 1,000. So this is the difference between the macro drip set and the micro drip set. Micro drip set, mostly for infusing medications. maybe for some pediatric patients or a patient where we're going to be really careful about how much blood volume or how much fluid volume we give them. Not blood, that's another video, but how much fluid we give them. And the macro drip set is either because they need IV fluids, they might need IV fluids, but not yet, so we're going to set the drip at to keep vein open or drop every 10 or 15 seconds. Or we're using it to give a medication that we're going to run fluids into after. Okay, so I just wanted to talk about a few other types of drip sets that we have, and one is a device called the Dialiflow that some agencies near us have used. And the way this works is you spike your IV bag and you set the milliliters per hour that you want it to run. You set your drip calculation and you can adjust this. And rather than counting drips in the drip chamber, you can set this and it will give you the fixed amount of the fixed flow rate that you want it to. Next it's the Buretrol. This is a device that allows you to infuse a fixed amount of IV fluid. So this end would go into your regular IV bag. You would cut off or clamp this end, allow your fluid to fill out if there's a specific amount. So you have a child and you want to give a fixed amount of fluid bolus to. And we decided we wanted to get 50 milliliters, and we don't want to give them too much volume. So we would fill this chamber, cut this one up, and then open it up, and then we know that fluid is going to go in, and then we can reassess if we want more. We can just more carefully track how much volume we're giving a patient using the Buretrol. And all of these IV pumps can be substituted for all of these. And last but not least, this is trauma tubing or blood tubing. And this has two ports. One of them is going to go to, if we're going to give blood, it would have to be normal saline. You couldn't give use lactated ringers in this case. If we're going to infuse blood in this, it would have to be saline. So we're going to spike a bag. We're going to fill this section completely. We'll go into more detail about how to do this later. So that this is like a pump, and this is the widest bore tubing, so we can get the most volume in. And so one of these would be connected to your saline, and then once that's been running, you would connect blood tubing to this. Lots of very exciting things coming with EMS blood administration.